Okay, so I have a few thoughts on healthcare, and I thought I'd make a short video just to describe my opinion on it. The political discussion on this topic sometimes is just completely upside down, right? Um, the debate just gives you two options, right? Whether you have the government provide healthcare insurance to the people, or you favor private companies and private insurance, private practitioners, etc. But to me, the answer to the problem we have in healthcare costs and healthcare issues in the population is mostly based on personal choice, individual choice. What are people doing every day to either improve or deteriorate their current state, right? Having free healthcare or easily accessible healthcare insurance is just a reactive way of solving the problem, right? So instead of trying to fix the cause of the problem, see why is this guy going to the hospital in the first place, we're saying, oh, well, let them get sick, go to the hospital, and then we'll figure out who's going to pay for it. So to me, the solution is to look at preventive reform, uh, maybe change around the incentives, right? So you can call this video reactive versus proactive healthcare, right? So the current system, it's corrupt because it incentivizes more procedures, right? The more things doctors do, the more exams you get. If you got to go get a CAT scan, whatever, that's more money in the pocket of the institutions and the companies involved in the process. But it doesn't necessarily address the root of the cause of the problem, right? So instead of giving money to those people that are involved in reactive healthcare, why don't we fund or create programs that incentivize a healthy lifestyle? Why don't we pay for people's gym memberships and give them tax exemptions if they can prove that they've been going to the gym, that their levels have improved this year, right? So imagine getting a tax break because you can prove that you have an active gym membership and that your BMI levels, your fat percentage levels are where they're supposed to be. That would be amazing. The other thing is, um, today with technology, you have the ability to constantly monitor different aspects of your physiology, right? Things like Fitbit are now becoming even cheaper than ever before. We can use those systems to have doctors just continuously monitor patients, right? So let's say I go to a doctor's office 5 miles from here. Instead of the doctor only caring about me when something goes wrong, he should be looking and analyzing the data that I provide to him, right, to predict, right, and try to prevent what's going to happen, right? So imagine some kind of subscription model where doctors will be paid when things are going good, and instead of incentivizing them getting paid when things go wrong, we should be paying doctors more when the population is healthier, right? So if, let's say a doctor is responsible for like 100 people, and I'm just brainstorming right now, right? But let's say one doctor is responsible for 100 people, right? If his 100 people are doing well, he should be rewarded for that, not punished, right? But the way it's set up right now is like the sicker those people are, the more time they spend in the office, the more money that goes in their pocket or their office, whatever. So if we can change that system, that incentives that go into that, if we can solve the problem of healthcare costs, we bring the healthcare costs down, and everybody will be a lot happier, right? I'm not opposed. I'm not saying here that we should or we shouldn't fund healthcare through the public sector. Maybe that is part of the solution, but I think that it's not a long-term solution because people are continuing to eat things that aren't good for them or not do enough exercise nowadays. So when you're sitting in an office 8 to 12 hours a day, and a lot of people are just working online now, um, But just throwing things out there. Hopefully, this inspires some people to create new products or to call your representatives and talk about the importance of prevention versus reaction. So that's pretty much it. If I think of anything else, I'll upload another video going into more detail on some other ideas regarding healthcare. All right, see you next time.